Hello, I'm Dr. Bruce Faure with Aurora Advanced Orthopaedics. I am a joint replacement specialist with our group. We've been working over the last few months on devising a different technique for hip replacement from the traditional approach. Over the last 10 years, there's been a significant effort in orthopedics to try to reduce the amount of invasion and trauma that's incurred when a person receives a hip replacement. Some very successful approaches traditionally have been achieved, but there's a different way that's being developed that seems to have some very significant merit in some patients. This is what's referred to as the direct anterior approach, and we are performing it currently at Aurora Grafton Medical Center. The direct anterior approach takes advantage of an anatomic window that's available in the front of the hip that allows the surgeon to access the hip joint without invading a muscle or potentially risking nerve or artery injury. This window is relatively small, but with some specialized equipment, in particular a specialized table referred to as the HANA table, and some other specialized equipment in terms of instrumentation, allows access to both the acetabulum and the femur, the two elements required from the bony architecture for hip replacement. This approach takes perhaps slightly longer than the routine approach. It is not for all patients, but in a steadily larger group of patients, this availability has allowed us to do the surgery. And with a greater, I think, comfort level in the early weeks of the replacement and an improved mobility in the early weeks of the replacement compared to traditional approaches. If you have hip arthritis and you want to be evaluated and considered for this type of approach, I'm certainly available to discuss this with you in a clinical evaluation, and we can determine whether this would be right for you versus any of the other traditional approaches which additionally work very well.
Okay, we're here with Joanne today, who had a total hip replacement done by Dr. Bruce Faure with Aurora Advanced Orthopaedics a couple months ago, and Dr. Faure used the new anterior approach. Joanne, tell us a little bit about what your experience was like right before and after surgery.
Well, before my surgery, there was so much I couldn't do, that I was in so much pain, I couldn't pick up anything off the floor. It would stay there. I mean, I just couldn't do it. It was so painful. I had, maybe 10 years ago, I had done a lot of traveling. I was invited to travel again, to go to Europe with my brother and his wife. I said, absolutely not. I mean, I couldn't even go to a grocery store and not hang on to the cart because it was just so painful walking. And I had the surgery on the 4th of February. The first day after the surgery, I got up. The therapist had me take the walker and walk with me. He says, "You sure are walking very fast." And I said, "Oh, really? Should I slow down?" And he says, "If you can go that fast, that's okay." And it was rehab, and I could do everything, and they are thinking, why are you even here? But it was for strengthening because I got arthritis in my whole body. And anyway, I went home on the 21st. My first appointment with Dr. Faure was on the 24th. And I was cautioned by the therapy department to take my walker just in case. And I was practicing with a cane in therapy, and I was doing well going up and down the steps with it. So she said, because maybe Dr. Faure would really prefer you use that. So I got to my appointment, and they did an x-ray first. And then I was told I could come into the office, and I hear this voice down the hall yelling. And I said, "Hi, Joanne." He said, "I want you to walk over here." And I said, "With my walker?" And he said, "No, without the walker." So I walked up and down, and this was a long hall, 2 times. And then he said, "Okay, you can come in the office now." And he told me I'm a month ahead of the recuperation I would ordinarily have. And it's been just so great. Right now it's 8 weeks, and I don't need a cane. I don't need a walker. I can bend down and pick up things off the floor. I can go up and down the basement. I still, for support, I do take the rail just to make sure, and it's just wonderful.
And now, are you hoping this summer to maybe travel and do some gardening? Do you think that's something you'd be able to do now that you've had the surgery?
Well, I'm hoping, because I love it. I've traveled so much in the foreign countries, but with the world the way it is, that's another story. But at least the stuff when I'm at home, I can go shopping, and I have to turn in my little handicapped in July, but I really don't even need it now. It's just like a miracle.